Welcome back to another episode of Black Health. I am your host, Dr. Michelle Kirwan Bythwood, board certified pediatrician, chief medical officer. And I want to remind you that your wellness is not optional, it's generational. So think about the legacy of health that you want to leave. As we begin today's show, I want to ground you in why this conversation matters, especially for Black and underserved communities across Miami-Dade. Fluoride has been added to our public drinking water for decades to prevent tooth decay, a preventable condition that disproportionately impacts families with limited access to dental care. For many low-income families, fluoride in the water is the only dental prevention that their children may receive. A legislative bill has been introduced to remove fluoride from our water, and this has sparked an intense debate amongst healthcare professionals and local leaders and community members. At the heart of the matter is equity. Will this decision move us forward, or will it put us back in affecting vulnerable communities? To help unpack this, what this means for Miami-Dade County, I am excited to bring to the show a powerful voice in health equity, dental care, and environmental justice, Miami-Dade president of the Miami-Dade Dental Society, Dr. John Nelson.
Good morning.
Good morning, Dr. Nelson. Welcome. Welcome to Black Health. It's a pleasure to have you on our show today. You
Thank
are
you for having me.
absolutely. You are a dentist and president of the Miami-Dade Dental Society, and I know you've been talking about this subject. I've seen you in the paper, on TV, etc. So I'm excited to have you on the show to further explore this. I want to just start off with what is fluoride and why has it been routinely added to our drinking water across the country, not just in Miami-Dade?
Well, fluoride is actually a naturally occurring mineral that is typically found in rocks, and it's released due to weathering or erosion of rocks, mainly in water sources. And fluoride is actually found in pretty much all our water sources, from everything from fresh water to salt water, spring water, even well water, at different levels of concentration. Our naturally occurring water here in Miami-Dade County has already zero point 0.2 parts per million of fluoride already in it. And so what fluoride helps to do is actually was discovered in the early 20th century in Colorado Springs, actually, where a dentist actually found that these patients or these residents of the city had these darker stained teeth. And with the darker stained teeth, they found that they actually had less amount of caries or cavities. And so, through many years of research, they ended up finding out that fluoride was actually the source of this. And the first experiment that was actually started, or the first municipality that it was actually added into, is Grand Rapids, Michigan, in 1945. And then there was a 30-year study that evaluated the efficacy of fluoride and also its dangers of fluoride. And ever since then, actually, they found that we had great benefits from fluoride. And since then, it's been added to municipal waters throughout the country and also throughout the world. And then in addition to that, obviously with the additive of the fluorination in the water, in Miami-Dade County in 1958, we started adding the fluoride to the water.
Okay, so how does fluoride, from a clinical standpoint, how does fluoride help prevent tooth decay?
Well, it helps to prevent tooth decay by doing a couple of different things. One, it helps to strengthen your tooth enamel, so which is the outer layer of the tooth. It helps to become more resistant to bacteria and acid attacks, which is what causes cavities. It also promotes remineralization of the tooth. And what that means is that basically your tooth is built almost like a matrix. And when the acid starts to break it down, it reopens up these pockets of the matrix. And what fluoride helps to do is it helps to remineralize that with basically phosphate and calcium to redeposit it onto the tooth enamel to help strengthen it. Also, it helps to reverse in early signs of tooth decay by helping to rebuild the enamel. And in children, it's especially important because our adult teeth that we have throughout our lifetime are actually being made after we're born. So the reason why we have childhood teeth or baby teeth is so that it gives time for our natural teeth to be made, because this process takes years. So when children take in fluoride, what it does is that the systemic fluoride gets into your body, and as the enamel is being made inside your jaws and inside your mouth as you're in your younger years, it helps to strengthen the enamel so that when your teeth erupt, or your adult teeth erupt into your mouth, they are nice and strong and can withstand the rigors of life.
So I want to pivot for a quick second because I'm a pediatrician and I'm constantly talking teeth with my patients as well. So those the baby teeth, those teeth are important, right? They're the building blocks for our adult teeth. We can't just ignore our baby teeth, and we have to take care of them, correct? Just want you to say a word on that real quick.
Oh yes, well the baby teeth are especially important because that's the teeth is basically, or the mouth is basically the beginning of the digestive process, and so being able to have healthy teeth enables you to eat healthy things. That enables you to basically you're able to chew the foods that have the good nutrition that you need in order for you to grow. And so especially having teeth is important, as healthy teeth, especially important in the younger population, whether that's toddlers or and up, because we want them to be able to eat very well and to be able to grow very well. And so having that proper nutrition. And so if your teeth are not healthy, or if you're having pain when you're eating, or any of those things, it could limit and restrict your nutrition. And so that could be very, very key and very, very important.
So, Dr. Nelson, we do need to take a quick commercial break and pay some bills. You're watching Black Health. We will be right back. Don't go anywhere.
It is filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
April 26th and 27th, Miramar Cultural Center comes alive with Rhythms of Africa, featuring special guest appearances by the legendary reggae icon Ken Boothe.
Sheltered me from harm.
Violinist Timola, Somerset Academy High School students, backed by the Rhythms of Africa Band, under the direction of reggae ambassador Willie Stewart. Get your tickets now at Miramar Cultural Center and Embrace Music Foundation presentation, hosted by Mayor Wayne Messam in association with the City of Miramar.
Get ready to groove at this year's Juneteenth Juke Joint on June 7th at 7:30 p.m. Enjoy live music by the W's, beats by DJ Cardi, visual art, and more. Get your tickets now at archcenter.org.
Welcome back. You are watching Black Health. We are with Dr. John Nelson, a dentist in the Miami community, and we were talking about this bill that has been introduced to remove fluoride from our water. Dr. Nelson, so often there's some public confusion or fear around various health issues, and there is around fluoride. What are some of the most common misperceptions that you hear? And also, are there legitimate concerns regarding the safety or long-term effects of fluoride that these lawmakers are putting forth?
Well, in regards to the myths that are out there in regards to cancer, fluoride, the number one myth because fluoride has been something that we've been using in the water for over 70 years. And so one of the big things that was initially concern was that fluoride was potentially a cancer-causing agent. Okay, that was one of the first myths from the 70s and the 80s and into the 90s. And the American Cancer Society did numerous studies on fluoride and its impact, and there was no cause of cancer in all the studies that were completed for fluoride. So that was the initial myth in regards to fluoride. And as we got into the 21st century, there was a new myth that came about in regards to potential neurotoxins or neurotoxicity of fluoride. And a lot of this was based on one study that was completed back in 2006. It was basically the start for all these discussions in regards to neurotoxins. And there were several studies. It was a study that basically aggregated a bunch of studies where they looked at the impact of fluoride or high levels of fluoride on children and their mental capacity. And so there was most of the first initial studies that were looked at were 27 studies that were completed in China. And all those studies that were completed were actually completed with high levels of fluoride. Now, like I was mentioning earlier, fluoride is a naturally occurring mineral. So it gets into all our waters and everything like that because it's just found in rocks and due to the acid erosion. So it's actually sometimes even drinking well water, it contains really high levels of fluoride, sometimes 4 parts per million or more. And a lot of those studies that were completed in China and also subsequently in different countries, all were related to times where there was very high levels of fluoride. So the normal fluoride that we recommend here in the United States is 0.7 parts per million. So that's 0.7 parts per million. And so when we're looking at some of the studies that were completed, they were looking at sometimes 100 times the levels that is recommended in our waters here. And so oftentimes when you saw those studies that talked about potential impacts of neurocognitive health in children, those were at levels that were found much, 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 much higher than what we currently have. And in addition to that, one of the studies that was actually completed in China was actually looking at the control group that they were using, because they were looking at children who had high amounts of fluoride in their water. And the control group that they were looking at in terms of what they compared those children to were children who were getting fluoride as well. And they were getting fluoride at 0.8 parts per million. So right around a little higher than what we currently had. So they were comparing the health. The control group was actually a group that was getting fluoride in the water, just like we were getting fluoride here in the United States. And so those were some of the most dangerous myths in regards to fluoride, something that's been studied over and over the years. And even with that original study that was completed, the authors of the study actually came out and said that this study should not be used to make decisions in regards to fluoride uses in the water in the United States, because of the fact that those fluoride levels that were looked at were much, 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 much higher than that were much more we're using in the United States. So even the authors of that original study that all of this has kind of been built on were actually remarking that, hey, this is not something that we should be using to make policy in the United States.
And is this what the lawmakers are using to propose this bill?
Unfortunately, that is not some of the. Unfortunately, they're not using some of this data that has been found or not found linking neurotoxins and or fluoride to mental health or mental development in children. And so that is something that I wish more and more lawmakers will actually look into, because if you're just reading the headlines and if you're just reading a headline that says fluoride could potentially has been found to lower IQ in children, then you're automatically just reacting to that, and you're not actually looking and digging into the science and looking to the studies. And oftentimes, some of these studies were poorly constructed and led to some questionable, more than questionable results.
So fluoride has been removed from the water, I believe, in other states or counties across the country and maybe internationally. What can we learn from their experience? Have we seen what the outcome might be of us removing our fluoride from our water?
Yeah, actually, ironically enough, we actually do have evidence of this, and there's a few municipalities throughout the country and also throughout North America and the world that's removed fluoride from the water. The best example, or one of the examples that was actually even studied, was from Calgary, Canada. Calgary's in Alberta, which is a province in Canada, where in 2011 they voted to remove fluoride from the water. And so as they removed the fluoride in the water, 5 years later, a pediatric dentist for the University of Calgary conducted a study where she looked at the caries rates between children in Calgary and children in Edmonton. So Edmonton is about an hour and a half from Calgary, so pretty much the distance from, let's say, downtown Miami to downtown Palm Beach. And as they found is that the caries rate for children in Calgary were twofold or 2 times higher than the caries rates for the children in Edmonton. And the only really difference that there was, the socioeconomic statuses were pretty much the same. The economic levels were pretty much the same. The educational levels were pretty much the same. The only thing that was different was the fluoride in the water. Furthermore, and this study was completed in looked at children in the second grade. Furthermore, there was a 700% rise in hospitalizations for children due to dental caries infection in Calgary versus Edmonton. So there was a follow-up study that looked at these numbers again back in 2020 and 2021. And this prompted the city of Calgary to actually reintroduce fluoride into their water because of the fact that this was having such a detrimental effect or impact on the children of Calgary. And so,
Dr. Nelson, I'm going to ask you to put a pin right there. We do have to take another quick commercial break. Those are powerful numbers, Dr. Nelson. That is incredible. And yet we're still moving forward potentially with this bill. Don't go anywhere. We're having an amazing discussion about this bill to remove fluoride from the water, our drinking water in Miami-Dade County. This is so important for our health, especially our children's health. Don't go anywhere. We will be right back.
Filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
April 26 and 27, Miramar Cultural Center comes alive with Rhythms of Africa, featuring special guest appearances by the legendary reggae icon Ken Boom.
Sheltered me from harm.
Violinist Demola, Somerset Academy High School students, backed by the Rhythms of Africa band, under the direction of reggae ambassador Willie Stewart. Get your tickets now at Miramar Cultural Center and Embrace Music Foundation presentation, hosted by Mayor Wayne Messam in association with the City of Miramar.
Get ready to groove at this year's Juneteenth Juke Joint on June 7th at 7:30 p.m. Enjoy live music by the W's, beats by DJ Cardi, visual art, and more. Get your tickets now at archcenter.org.
Welcome back. You are watching Black Health, and we are talking about fluoride in our drinking water and the importance of fluoride working against tooth decay. We are here with Dr. John Nelson. Dr. Nelson, I don't know if you want to finish up the last point that you were making. If not, I will move on to my next question for you.
No, I mean, I think, like you were asking in your previous question, I think we have the data from what happens when you remove fluoride from the water. And there's already, in the last 15 years, we've actually had to build 10 additional dental schools in the United States because of the fact that we don't have enough dentists and there's a dental shortage in our country. So if we're going to go and start removing fluoride from the water, we're not only going to have a higher caries rate, but we're also not going to have the amount of providers that are going to be able to help the population. So it's going to end up being a double whammy impact if we do this. And like I said, other municipalities have tried, and other municipalities have found that they've had to reintroduce fluoride into the water.
So, Dr. Nelson, is there an alternative solution or a middle ground where maybe we just decrease the fluoride a little bit versus removing what we add?
Well, this is something that's been studied for many, many years and trying to find the optimum level of fluoride in our drinking water. And we found that the best level that's efficacious at is 0.7 parts per million. So if we were to remove the fluoride from the water, it's hard to replace that because, like I was mentioning earlier, what sometimes people don't realize is that there's two different types of fluoride. There's the fluoride that we ingest systemically that works basically from the inside out, and then there's fluoride that we basically apply topically to help to supplement some of those things. They do not work the same way, and the systemic fluoride works the best because it comes from within. When we're trying to add it on topically, so it helps a little bit, but it doesn't give you the actual same benefit. So when we put it in toothpaste, when we put it in mouthwash, or any other type of gels or anything like that to help to increase the amount of fluoride in your mouth, it does not work the same way as the fluoride that we ingest systemically. And in addition to that, also we can't replace that when the adult teeth are actually being made. We can't replace that fluoride that helps to go into building that tooth to making it nice and strong. And so you're going to be, once those adult teeth come in, you're going to have weaker teeth.
So I want to maybe give a little hope to parents that are watching and families that are watching. Is there anything a parent can do to help protect their child's teeth if the fluoride is removed from our water?
Well, obviously trying to make sure that we are on top of our children in terms of their brushing, monitoring your child when they're brushing their teeth. Oftentimes we send our kids upstairs to go brush their teeth and not necessarily monitor them whether they do a good job or not. And so making sure that you're stressing the importance of oral health into your child's life. Early childhood education is always the best in terms of teaching them the proper way to brush, the proper way to floss. And so staying on top of your child is it's going to end up being very, very, very important.
Dr. Nelson, sorry, go ahead. I also want you to mention the event that's coming up.
Oh, yes.
In Miami Gardens.
So those are going to be the things that are going to be very important for parents to do. In regards to the event that we're having this weekend, the Miami-Dade County Dental Society, I'm actually president of the Miami-Dade County Dental Society, and we're the local chapter for the National Dental Association, which is the Dental Association for Minority Dentists. And we've been looking to do an event like this within Miami-Dade County, where we're going to be able to provide free dental care for patients, for residents of Dade County or even Broward or wherever you're coming from. And basically, we're going to be doing free exams, free cleanings, free fillings, and free extractions. So if you had a tooth that's been bothering you that potentially needs to be extracted, we can take care of that for you. Any teeth that probably potentially need some fillings, if you recently were diagnosed with some fillings and you were unfortunately couldn't afford it or didn't have the time to go, we're going to be available this weekend from 6 a.m. to 6 p.m. on Saturday, from 6 a.m. to 1 p.m. on Sunday. And this is going to be held at the Betty T. Ferguson Recreation Complex in Miami Gardens. It's first come, first serve. The only thing that we ask that you bring is an ID and that you be 18 years old and over. But this is going to be a very exciting event for us to be able to. We have volunteers packed in fields that are ready to provide dental care and dental services to anyone and all who come.
That's an amazing service. I'm wondering how many dentists you have coming out, because I'm thinking the community will be coming out in numbers. Get there early, folks. Get there early.
Actually, we do encourage, if you can arrive a little bit early. Our doors open at 6 a.m., but we'll be ready to go right at 6 a.m. So if you want to come in a little bit earlier to stand in line, to get in queue, we can make sure that we can accommodate you for that if you want to come extra early. We actually encourage it a little bit too. This is going to be, again, an exciting event that is going to help and benefit the community, especially in Miami Gardens, and we're looking forward to putting this on.
I'm excited for that, for Miami Gardens. That's where my health center is, the health center that I work at. So I'm a Miami Gardens champion, and I'm excited. I was really excited to see that flyer. It came through my email and phone yesterday. So we do need to start wrapping up. Just to close, what is one message you'd like to leave to our listeners about fluoride, about health, and about this proposal that is upcoming?
Well, I know we're focused on children, and it's very, very important because caries or cavities is the most chronic childhood disease in America. It's 5 times more prevalent than asthma. It's way more prevalent than hay fever. Anything that you can come up with, childhood caries is the most important, is the most chronic childhood disease. So removing fluoride from our water is only going to impact our children. It's also going to impact our adults because fluoride has a way of fighting back against all bacteria in your mouth, to make your gums healthier, to make your teeth healthier. If we're going to remove fluoride from the water, we're going to be opening up a can of worms that's going to be generational to reverse, because this is going to impact children for their entire lives. And so Very, very, very important that we try to maintain fluoride in our water. If you need to contact your county commissioner, your local commissioner, there's a list. Go to miamidade.gov, find your county commissioner, reach out to them, let them know that you want fluoride to remain in our water. You want fluoride to remain just as we've been using it since 1958 in our county, and it's dramatically helped to improve the outcomes of dental caries in our community. That's been proven. And so please, please, please contact your county commissioner. The vote is May 6th, so which is almost 10 days from now. So please contact your county commissioner to let them know that you want fluoride to remain in the water in Miami-Dade County.
Awesome. Thank you for that, Dr. Nelson. And Dr. Nelson, you are a practicing dentist still,
Yes.
correct? Where
Yes.
can potential patients find you if they're interested to come and see you and coming to
Well, I
see
work at Midtown Dental, which is near Midtown in Miami-Dade County. We're actually on Biscayne Boulevard, 3915 Biscayne Boulevard. You can look us up at our website at www.midtowndentalmiami.com. Or if you just Google Midtown Dental, we should easily come up for you. And we have varying office hours. We have late days. We have work on Saturdays. So we try to compensate all who are not able to come to the dentist during the work hours. We're here on weekends and evenings as well.
Awesome. Thank you so much for joining us today, Dr. Nelson, for taking time out of your busy day, seeing patients, advocating for patients, and doing all that you do for our community. I thank you so very much. It's been a pleasure to speak with you today.
Well, you're very welcome, and thank you for having me on.
Absolutely. And for those of you that are watching, we thank you for watching and supporting Black Health. I am your host, Dr. Michelle Kirwan Bythwood, and I will see you again the next time. Find me at Black Health Show on IG. Take care, everybody.